Hello everyone. Today we are going to discuss the concept of health and disease. My name is Tariq Siraj Qazi, and today with you we are going to discuss some key concept about health, disease, natural history of disease. So by the end of this video, the viewers will be able to understand the term health, disease, and well-being and what is the difference among these terms. Uh, Describe the concept of causation, understand the health indicators, and the natural history of disease. So, what is health? According to World Health Organization, it states that any state of complete physical, mental, and social well-being, not merely the absence of disease, and recently added that the ability to lead a socially and economically productive life. So, a person with all these characteristics, we will call him a healthy person. But when we talk about the health and epidemiology, so it says that the presence or absence of disease, if the disease is present, then he or she will consider unhealthy, or if the disease is absent, we call it healthy individual. Now, what is a disease? Disease is an abnormal condition affecting the body of an organism and characterized by specific signs and symptoms. So we call it disease. On the other hand, illness is a state in which a person feels unhealthy or ill. It doesn't mean that if you are ill, it means that maybe you are not having any disease, but you feel uncomfortable, so you are unhealthy. According to this definition, so illness is a state of mind of a person that whether he feel unhealthy or um, unhappy or ill, and disease is any abnormal condition which is going on in your body. Now, health disease continuum. It says that health and disease is not a separate state of being. It is actually a continuum which allow the patient to move from a healthy state to the disease and from the disease to healthy. For example, here you can see the neutral point in between, which is a slight brownish. So from here, if you see, if you go to the right hand side, you you go out for awareness, you get education about your health condition, and your growth and development is proper. So you will go to the high level of wellness. But if you are having some sign and symptoms, and you don't treat that underlying condition, and a disability appear, then there will be a premature death. So it is a continuum which allow you to either go from a healthy state to a disease state, or from a disease to healthy. Now, what is well-being? It is a state of being healthy, happy, prosperous, successful in a sense that satisfaction with economics, social, medical, spiritual, and physiological condition. So it is a high state of uh, healthiness. Now, what is concept of causation? So there are different theories about disease causation. For example, we talk about the germ theory of disease. Is put forward by Louis Pasteur and confined by Orkop. So the disease are caused by microbes, they say, and one organism cause one disease. That is the germ theory of disease. Now another is epidemiological triad. It states that disease is caused by interaction between agent, environment, and host. They say that if there is an equilibrium between the agent, environment, and host, then the disease will not initiate. For example, if there is an agent, causative agent, and environment, but the host is not susceptible for that, the host is having a high immune level. For example, if we talk about COVID-19, so in COVID-19, if a host is following all the guideline by WHO. He is wearing a mask, regular hand washing, don't touch his eyes and mouth, and don't shake hand or touch things randomly. So whatever the condition is, the environment is susceptible for the host, but the host is um, getting all the things right. So he won't initiate any disease. But if a host is above 70, he is at high risk. If he is not following the guideline, he is at high risk. And the environment is dirty. There are some affected people. So the agent is there, and then the disease will initiate. So actually, epidemiological triad says that disease is caused by the interaction between these three things. Multifunctional causation, it means that disease is not caused by a single thing. It is a multi factors will be there. For example, cancer, there are a lot of things going on. The other is web of causation. It states that any disease there is a complex interrelationship between the factors that cause it. For example, if you talk about obesity among the adults, so if we see, there will be stress which can lead to obesity. Loneliness can lead to the stress, and stress can lead to the obesity. Loneliness can also lead to obesity. Same goes with the lack of emotional support, living arrangement, your diet, and lack of nutritional education or other education. All these things are linked with each other. So it is the web of causation. Now, what is health indicator? It is a quantifiable characteristic of a population which a researcher uses as supporting evidence for describing the health of the population. For example, if we talk about the health expectancy of a certain area, so we said that the life expectancy is quite high. It means that the researcher use this characteristic as an evidence to say that if the life expectancy, which is actually the average lifespan of an individual, which if, for example, if it's high, it says that the health of their population is quite good. They are taking care of themselves, they are well educated, their nutritional level, their socio-economic status, everything is okay. That's why their life expectancy will high. But if we talk about Ethiopia, the life expectancy is quite low. So because of this characteristic, which is quantifiable, so the researcher can give a supporting evidence to describe the health of their population. Now the government collect this information on each citizen age at the time of the death. When the person die, they collect the information of those citizens, and this data about the age at death can be used to support the statement about the national life expectancy. Now the other health indicators might be death rate, immunization level, economic problem, tobacco use, and mental health, etc. Now, this is important that we should know about the natural history of disease. So, natural history of disease is the progression of a disease process in an individual over time in the absence of intervention. If we are not doing any interventions to cause their problem, and the disease process progresses inside the individual, we call it natural history of disease. The more the more presence of agent, host, and environment is not enough, as we say, because unless there is an equilibrium between all these things, disease will not initiate it. We already discussed this point. Now, stages of natural history of disease. We divide the natural history of disease into main stages, which are pre-pathogenesis and pathogenesis phase. Now, what is pre-pathogenesis phase? In this stage, the disease is not developed, but the ground has been led by the presence of factors that favor the occurrence. For example, if you consume too much alcohol, So it can lead to liver cirrhosis. You see, liver cirrhosis has not been developed yet, but too much alcohol consumption has already led the ground for the disease to initiate. High cholesterol and obesity, smoking, hypertension, and high cholesterol can lead to stroke. Now, the second is pathogenesis. In this phase, we divide it into three sub uh, types: stage of subclinical disease, stage of clinical disease, and stage of disability. So, you see here, when the disease is initiated but the symptoms are not there, so we call it stage of subclinical diseases. Number second, disease process has begun, and when the sign and symptoms appear, this stage will end. So it is actually the stage before the sign and symptoms appear, but the disease is already been initiated. Also called incubation period. For example, hepatitis A, 2 to 6 weeks. This is the incubation period. Disease is initiated, but the signs and symptoms will not appear during this period of time. So we call it subclinical disease stage or incubation period. Now the other stage of is clinical disease. So it starts when the onset of symptoms appear. When the symptoms appear, this stage will start, and this depend on infectivity. And infectivity means proportional of exposed person who become infected. Now a disease having high infectivity, it means that whenever a person exposed it, he will get that infection. Pathogenicity, proportion of infected person who develop clinical disease. So when you are infected and the signs and symptoms appear, so this is called pathogenicity. Virulence, the proportion of diseased person who becomes severe ill or maybe die. So it's called virulence. Now, for example, if you talk about rabies virus, it is highly pathogenic and virulent. Pathogenic means that an infected person will there is a high chances that he will develop a clinical disease, and there is high chances that he will become severe ill or even death will occur. So, and when we talk about hepatitis A in children, it is low pathogenicity and low virulence. Now, the third stage is stage of disability. Some disease resolve completely, but some may leave residual effect of short-term or long-term duration, leaving a person disabled. Now, disability, we already discussed it, is that when you do cannot perform your daily activities. For example, walking is a normal activity, but if you got a diabetic foot, you are disabled to do that normal function. Thank you so much for listening, and please subscribe my channel and press the bell icon for regular updates. Thank you.